Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Radio Friends on Wednesday, October the 13th. We're going to talk about COPD. Are you someone who is dealing with COPD, or you know someone who is? We have two experts with us today from the Truman VA Hospital. Dr. Satish Kalanjeri, good to have you back again, Doctor.
Nice to be here, Paul.
And Dr. Jeremy Johnson. This is the first time you have been with us.
That's correct. Thank you.
You have a procedure that you were performing over at the VA hospital, which increases the volume in the lungs for people with COPD. Is that a fair statement?
Yes, to some extent it is. What it actually does is it reduces the volume in the lung so that the good parts of the lung can occupy that reduced space and work better.
Okay, is this an invasive procedure that you're doing?
It is.
And how does that work?
Well, this procedure is done through what's called a bronchoscope, which is a thin, flexible tube with a camera attached to its end. So we place the bronchoscope in breathing tubes, and then we place what's called a valve, a one-way valve. What this valve does is it lets air out of that part of the lung, but does not allow air to enter the lung. So this results in that part of the lung, let's say the upper part of the left lung, is the target that we have chosen. The upper part of the left lung does not work well, and what it's doing is it's bothering the other parts of the left lung in doing their job. So by placing this valve, we slowly deflate the upper part of the left lung, for instance, and this area is now occupied by the lower part of the lung, which then works better.
So is this a permanent fix, or is it something that will work for a while and then you have to go back and do it again?
It is not necessarily a permanent fix. These valves can be removed over time. Now the question is, will it work forever? Mm-hmm. What the studies have demonstrated so far is that these valves have sustained effect at 1 year and perhaps at 5 years. What we don't know is whether the effect will last in all patients over time. That we'll find out in the future.
So is this a new procedure then?
The procedure has been there for quite some time, but it is only now that we have noticed that patients are benefiting from it because we have gotten better in choosing the right kind of patients to undergo this procedure. So yes, it's been approved only recently in the last couple of years for COPD or emphysema treatment.
Okay. What do you want to add to that?
Nothing. It's become a novel treatment for COPD, and I think the really neat thing is that not every center is doing it, and that we have leadership that we really want to take care of our veteran patients, and so we've really pushed and advanced the technology, and so this is a new technology, and so if it's something that can take somebody with advanced COPD that's breathless at rest even, or with minimal exertion, and we can reduce the volume of hyperinflation, air trapping in their lung, then they can have quite symptomatic improvement from this procedure.
What causes COPD?
So for the most part, it's smoking related. Not everybody that smokes cigarettes, and we're talking about nicotine and tobacco, not everybody that smokes develops COPD. Not everybody, we don't know exactly, but the inflammatory cascade in our lung, the response to cigarette smoke, may cause airway narrowing, increased secretions, and this can all narrow the airways of the lung and then make somebody quite symptomatic.
Now, if you've never smoked in your life, could you still contact COPD?
Absolutely. It's a much more less common non-cigarette smoking causes of COPD, but we do know patients with certain genetic predispositions, something called alpha-1 antitrypsin deficiency may develop COPD without ever smoking a cigarette. Now it looks like maybe secondhand smoke and third-hand
I was going to ask you that next.
can lead to COPD. And we know, people with other environmental and occupational exposures, we see it somewhat commonly in farmers. And just any noxious particle that can inflame the lung can lead to COPD. But by far and away, cigarette smoking is the biggest cause.
Reversible? If you have COPD and you stop smoking, will it go away, or is it something you've got it now?
Right. Once you develop airflow obstruction or airflow limitation, it's there, and we can't reverse it. Clearly, quitting cigarette smoking or avoiding whatever the noxious particle is will be benefit. We can get you back to, less lung volume reduction if you avoid those things. But you can't reverse the damage that's done. And so then we need to talk about how do we treat symptoms, and that may be with inhalers, that may be with this novel procedure that we're talking about now.
Dr. Kalanjeri, how many people who have COPD would be a candidate for this procedure?
Well, the ideal candidate for this procedure is someone who has got, as Dr. Johnson pointed out, what's called hyperinflation. Now, with COPD, what happens is the lungs get inflated, and you can imagine, and if I may demonstrate this quickly, if the lungs are inflated like a balloon, and then now we have to run and do our activities and talk with hyperinflation, then it becomes difficult to perform those activities. And so we deflate part of the lung that allows us to breathe, take deeper breaths, and do things more. So the ideal candidate is one who, on their breathing function test, a test that is performed at the hospital, has a lot of air trapped inside. So not every patient with COPD will benefit. Probably, a quarter or a third of them might be candidates, but there are other criteria too they have to meet before they're eligible for this procedure.
And this would not, and we're almost out of time here, but this would not be something that you would do for anyone who has asthma.
No, not for asthma. The valve procedure is not for asthma. There is a different procedure for select patients with asthma called bronchial thermoplasty, which is also performed at the VA hospital. Again, not every patient with asthma is eligible for it. Not every patient with asthma needs it. So they will have to be evaluated before undergoing any invasive procedure.
Right. Okay. That's very enlightening. I appreciate both of you coming by today. If people want more information about this, if they have COPD, what's the best way to get the info?
Well, they can visit our website, or they can call the main VA hospital number, which should be displayed on the screen, and extension 53363, and that'll come straight to our department.
That's 8146,000, extension
53363.
53363. Okay. If you want more information about that treatment for COPD. Thank you so much for coming by. We appreciate it. If there's something you'd like to hear or see, I want to hear from you. Pepper P, Missouri.edu. Have yourself a nice day.